Hey everyone, this is Daniela from the Obstacle Doc, and today we're talking about floor or snow angels. This is a great assessment as well as exercise for increased overhead mobility, as well as an assessment for the pelvic neutral abdominal flexion control. So we are going to start laying down. This is going to be a 90-90 position for your upper body. So you're going to have your arms in goalposts on the ground with your knees bent. So this is the starting position for our snow angel or our floor angel. We are going to be just checking in with our body to notice what we feel feels good or maybe doesn't feel as comfortable, maybe is a little bit tight in this position. For some people, just having this starting position might be difficult because of being in our forward kind of kyphotic positions at our desks, on our phones. So opening through the chest might feel really uncomfortable. We also want to notice how high or low our elbows, our forearms are, as well as what is going on with our lower back. So for some people, just this position of tightness might be already pulling up through their rib cage. So just noticing without judgment, but first just keeping a mind's eye on it. All right, so keeping space between my chin and my chest, I'm gonna start to extend my arms overhead, keeping my knees bent. I just wanna start to notice what happens in my body. If my elbows or my wrists lift off the ground, if the back starts to arch more or less as you go overhead. And this can start to tell us information about what's feeling tight or what's not getting some control as you're coming up and down. That is the first part of the assessment. We are going to keep our arms here for the second portion, which is slowly extending out one leg and then the other. What you might notice is a change through the middle of your back, low back, or through your elbows and your shoulders. For most of us, if we're carrying any sort of tension through the lower body, through the lats, we might start to feel more of an arch come through when our legs are extended. If you can imagine, this is a standing position, and we're going to show you that in a second. So now with our legs in extension, we're going to take our arms overhead and just watch for the same things. Am I extending more through my back? Are my arms not able to stay on the ground? Am I lifting up from my forearms or my wrists? Also for unilateral differences, so does one side go up higher than the other? Am I able to maintain control through one side better or not? So if you find that you are overextending through your low back or that you are flying your elbows or forearms off the ground, we're going to try to play with this position by getting our rib cage to close down, activating through our abdominals, maybe squeezing through our glutes a little bit to hold ourselves in pelvic neutral, and then trying to see how high we can get overhead. If you can still get equally as high, fantastic. It was just a matter of control. If we're having a little bit of difficulty now that we've locked down the middle of our body, we might be experiencing some tension through the lats, maybe through the top of the shoulders, and both of those things are going to give us different pieces of information to your puzzle. We can also try extending our legs out, keeping our arms in the snow angel position, and just pulling down from our midsection to hold down that pelvic neutral. That might be hard enough to just start with, and that's perfectly fine. You can hold here for a couple seconds and then release, hold, and once you get a good hold, then you can start to play with the arms overhead. So for our wall angel, we are going to start with a foot on the wall, heel hitting the side, and then you're going to take your next foot in front and then match your step. So the reason that the wall angel can feel a lot more challenging than the floor angel is because gravity is now a factor. So we are going to be a foot off the wall, let your spine come flush to the wall behind you. There is still this 90-degree bend in your neck, and we are going to just be mindful of the space between our low back. We're going to take our arms out to the side just like we were in our floor angel. And again, this is as far as we're going to get first. We're going to hold here, make sure our arms are 90, and just start to notice, again, differences through one side versus the other when you're on the wall. This might be enough to start with if the floor angel is already challenging, if this starting position is already challenging. However, if this feels okay, then you can start to move overhead. And as you can see, we're a little bit limited today. So going to where you can without flying off the wall or changing the composition of your spine to the wall as well. So holding in neutral, sliding up and coming back down. We usually recommend at least 5, 10 would be great. 12 is a nice spot to stop if it's starting to feel better or worse. We can take this in rounds. You can do 2 or 3 sets. I always recommend starting on the ground and then moving to the wall when you're ready.